Hi everyone, it's Neil, your friendly pharmacist here on Lynch's Live at Lynch's Pharmacy, Farrell Street, Kells County Meath. Always Lynch's, always live. So this video we're going to talk about the upcoming hay fever season. You know, it's always a hot topic every summer. We seem to have more and more people who are affected by pollen, and that is across the ages from very young children to everyone in between and to our grannies and granddads out there. And some of us are presenting for the first time when we're young, and some of us are presenting from the first time even when we're much older in life. So what's going on? Is it the pollen? Is it pollution? Is our diet? I don't think anyone really knows, but all we know is that more and more people are suffering from allergies. So hay fever, what is it? It's an allergic reaction to pollen. Pollen comes in many forms. It comes from trees, it comes from grass, it comes from weeds. So the main season runs from March to October. In spring, we have mostly tree pollen presenting. That would be birch and hazel. In late spring and early summer, it will be mainly grass pollen that's affecting everybody. And then in early spring and late autumn, it is weed pollen that is causing most of the problems. 20% of the population can be affected by hay fever, so that's 1 in every 5, which is quite a high amount of people. It's fairly common in families who have a family or genetic history of allergies or eczema or asthma, as they're all very closely connected. Children can be affected from 7 years and upwards. It's mostly boys than girls at this early age, but then it generally evens out over time. So what are the common symptoms? What will you see presenting in front of your face when someone has an allergy such as hay fever? So sneezing is very common. Runny noses and runny eyes are very common. The eyes can also be very itchy while they're watering. We can have a scratchy throat, and we can have nasal congestion, so we can have lots of blocked noses. So how do we treat all members of our family? So we're going to focus on families for a lot of these videos, from young and up to adults and everybody in between. So one product that's used a lot over the hay fever season is called cetirizine, and you might know it by the name of Zyrtec, or the generic product is Antihist. Zyrtec and Antihist both contain cetirizine, and it's a fairly good antihistamine because it's non-drowsy and it can give you a lot of relief. You get the same amount of medicine. That's a 100ml bottle, that's 200 mils, so you're paying for a brand name there of the exact same drug. It's suitable for children over 2 years of age. From 2 to 6, we take 2.5 mils twice a day, and then from 6 to 12, we take 5 mils twice a day. And there's also adult preparations tablets of this same drug. Again, the generic offers you much better value over the course of the summer if you're going to have to be taking it every day. Sometimes we try antihistamines and they don't give us the relief that we want to get, so then we have to change to a different antihistamine, and that happens quite a lot. A lot of times we don't get success with our first one, so we try a second one, we try a third one, and we see how it goes on. Another option that we can recommend is Phenergan. Again, this is another antihistamine. From 2 to 5, we can have 1 to 3 5ml spoonfuls, preferably at bedtime because it causes drowsiness. That's the best time to take Phenergan. We don't want to be feeling drowsy during the middle of a summer's day. As always with all of these medicines, seek our advice, ask us how much to take, and always read the instructions, okay? When we're not getting enough relief from oral antihistamines, we can add in different products. So if our eyes are being affected, as well as taking an antihistamine, we could add in eye drops. If our nose was being affected, we could add in a nasal spray as well. So one common product that we would recommend alongside our antihistamines is eye drops, because the eyes can be watering, they can be scratchy, they can be itchy, and it can be quite distressful for everybody. So one product that we can use is the otta range. Again, it's an eye drop. It will go into the eye, it will work specifically in the eye, it will complement the antihistamine regimen as well. It's going to soothe the itchy, watery eyes, which is what we want. And it's available for children as well. If you're going to be applying it to children, it's often easier for them to lie down and make sure you wash your hands, pull down the lower eyelid, and sometimes you might need to distract them using a toy or something like that. One of the older traditional remedies for hay fever was to line the bottom of your nose with Vaseline, and it's still good, you know, it's traditional, but it works. The oldies are goodies still. So the way that works is the Vaseline catches the pollen before it has a chance to go up into the nose and land deposit here, which is where you get your congestion, and it also contributes to your runny eyes. So we've moved on from Vaseline, you know, it's still good, you can use it if you don't have anything else, but we also have this range, it's called Prevalent. It is used for children and it's used for adults. And again, it works in kind of the same way as the Vaseline. It forms a protective coating over the inside of your nose. So even if the pollen does go up there, it's never going to hit the sensitive spots and lead to all the problems associated with hay fever. Another product which was extremely successful last summer, and we will imagine it will go well, is the Hayfever bands. So these work on acupuncture areas of the body. Again, a lot of families wanted to try this product last year because it was non-drug based, and if we can slow down the time we have to introduce drugs to our children and all members of our family, that's a good thing. So it's definitely worth an opportunity, and you should try it out. But know that, you know, if you're not getting much success using the hay fever bands, that the medication can complement the hay band, and it's a good place to start off with. So we believe that prevention is always better than cure. And by following a few simple tips, it can help you have a better hay fever season. Maybe reduce the amount of medication you have to buy, maybe reduce the amount of GP appointments you have to make, time and money-wise. So if the pollen count is high, you should really keep children and all your family members out of the outside. I know it's extremely difficult in the summertime, but you know, it is a practical measure. Wraparound sunglasses are recommended as they prevent the pollen from going into the eyes. It's worthwhile if your children have been out showering your children and washing or taking off their clothes and putting on new clothes, because the pollen's lying there and you know it's going to have a continual effect if it's on the body or on the clothes. And when the pollen count is high, maybe it's a good time to close your windows and stop the pollen getting in. Car windows should also be closed as you're traveling along. If you know somewhere's just cut their grass, you know, you should really avoid this area. No fresh flowers in the house for pollen sufferers out there. I know that might get a lot of men off the hook for not buying flowers, but if you've got a hay fever sufferer in your house, they probably won't appreciate the flowers that much. Children's clothes and children's bedding, if you're drying them outside, you know, you have to consider the pollen's going to land on the clothes and the bedding, and that's going to have a knock-on effect. So they're all real practical tips. Not so easy to do all of them, but you know, you can try at least one of them. So when we get a patient in here, we'll try and treat them ourselves. You know, we've got a lot of medicines, we've got a lot of practical advice, but sometimes we do need to refer people onto the GP, because GPs are an excellent source of help and they have access to a lot more medications than we can recommend, especially prescription ones. So when will we refer? We will refer if the case of hay fever is severe and if we haven't had any luck treating an OTC. If a child or a family member is persistently unhappy and we're not getting anywhere, we should probably refer. If children under 2 are presenting with hay fever, it's not typical, so it's always worth investigating why someone under 2 would get it. As I said, we're more likely to get it over 7. Hay fever, because of the runny nose and the blocked nose, it can lead to sinus infections. So if we suspect a sinus infection, we may have to refer you to GP. And if we're not getting our symptoms under control with all of these medicines, then we have to refer you on. So that's our talk on allergies and the upcoming hay fever season. Keep posted to the page. You'll see lots of practical tips and products probably going over there over the course of the summer. The best consultation that we can ever give you apart from this video is a one-on-one. We've got lots of pharmacists based 7 days a week in this pharmacy, and we would all love to see you. So thanks for watching, and always stay tuned to Lynch's Live at Lynch's Pharmacy, Farrell Street, Kells County, Meath. Thank you.